One thing I always recommend, it's very common for the actual catheter to be stuck to the needle. So if you just twist it a little bit, that'll make sure it's not stuck. Many very good medics, advanced EMTs, people learning the skill have had the issue where they start the IV, everything's good, and they go and they try to break it apart and it's just kind of sealed up and they lose the IV because of that. And you don't want to lose a difficult IV because you didn't do that. So really easy, just break it, make sure it's nice and loose. That way, when you go to slide it and pull it all apart, which we'll see in a second, it's easy to do, okay? Like I said, this is a slide type IV catheter. So there's a little, I don't know, little piece of plastic here to help you guide that. Make sure that you're learning your technique and you're practicing your technique, whatever that is. There's gonna be a couple different ways to do this. I like to grab with my thumb and my middle finger. That way I can control with my, my pointer finger there, okay? So that's how I like to do it when I'm doing this, like you're fancy drinking a little cup of tea, right? You're gonna hold it here, and I like to hold here. If I'm holding like this and I go to start my IV, I don't have any dexterity to push this forward like I need to. So that's why I go here, I leave my, my pointer finger free, that way I can push forward, okay? I'm doing this right now, you should not do this. You can cause catheter shear. So typically we don't want to push our catheter up and go back again because that can break off a small piece of that plastic